I'm James Dunlop.
And I'm John Chaxfield. Welcome to Gold Coast Secure Mental Health Rehabilitation Unit.
We're incredibly fortunate to have a world-class facility where consumers and clinicians can work side by side towards recovery.
Let's take a look. The consumers that we work with here all have complex needs, but when they get to this point in their recovery, they're not unwell. They're usually stable on medication and they're ready to do the work of recovery and move forward, learn skills and grow in their ability to cope in the community.
This is our family lounge area where consumers will have the opportunity to catch up with visitors when they come to see them. We have a beautiful, comfortable space with really nice furniture and a really lovely outlook as well. And we also have blinds that come down when needed for privacy. This is our activities of daily living kitchen where consumers can engage in cooking groups and gain those practical life skills needed for when they engage back in the community. Our consumers will be staying with us for an extended period of time, of sort of 6 months to up to a year, so it's important that we have a comfortable space for them. So each person will have their own bedroom, workspace, storage space and TV, and their own ensuite bathroom as well.
So one of the things that is in the routine of the nursing staff is to be able to check people at night to make sure that they're sleeping okay. And so we've got this observation panel that automatically opens and turns on a small night light, so that means that nursing staff don't have to actually enter the room and disturb the person who's sleeping. So we're here now in one of the courtyards. There are 3 courtyards here, and the way the building was built was so that there were no fences. So in fact, the perimeter of the building surrounds these courtyards as a way to make things more pleasant for their consumers.
And these courtyards were designed with lots of natural light and natural space in mind. So they're a comfortable, easy place for people to be, engage, play games, and just to enjoy outside. We all know how important physical activity is for supporting our mental health. So at the unit, we have a basketball ring, a gymnasium, and an exercise physiologist to support consumers with their physical health. As we come past one of our nurses' stations, we open up into our communal lounge and dining area.
This is where some of our consumers will be having their meals and where it's a great place for staff to spend time with their consumers and get to know them. We have 2 sensory rooms on the ward, and they're equipped with comfortable chairs and nice lighting. And the idea is that they're a space for people to come into when they're feeling a bit overwhelmed or stressed and they need to come and relax. And here we have one of the therapy rooms. Part of the program that we offer here for people during their stay between 6 to 12 months is a program of activities. And that includes things like art therapy, music therapy, but also other types of therapy and groups that help them develop their capacity to live independently in the community. I think a lot of the staff are really excited, I certainly am. It's an amazing unit with so many resources and lots of staff training, so I think it's a superb opportunity and a real career opportunity for many of the staff that are here. This environment is probably one of the safest environments that people can be in. All the staff are highly trained. There are lots of environmental checks and balances for security and safety for everybody. And one of the most important things is that staff really get to know their consumers well. So you can understand when someone's becoming unwell perhaps or not feeling so good for a day, and you know then what you can do to help that individual.
So this is the first time the Gold Coast has had a unit like this, and it's incredibly important for our consumers because it's the first within this area. So each consumer and each person that comes to this unit, they locate nearby and they have family and carers and friends nearby, which means that they can be central to that community.
So as part of their rehabilitation, consumers will be able to work with art therapists, with psychologists, music therapy, exercise physiology, occupational therapy, and various other disciplines who come in to help us. I'm really enjoying working in this environment. I think for many of our staff, it's an absolutely fantastic opportunity for them to be working in something from the beginning with world-class experts in a facility that really is state-of-the-art.